So I want to start by talking about diagnosis. Um, Often the first thing that brings these to attention is the patient saying, hey, I have something going on in my leg, my arm, or in my abdomen. So that might be pain, that might be a mass that they can actually feel if it's in the extremity, or weight loss or GI bleeding that might clue us into something going on within the abdomen. And the next step is, of course, to get some pictures, a scan. In the bottom right, you can see an example of an MRI of somebody with a sarcoma in their leg. You can see that bright white piece, and you can sort of see their long bones coming down. And so this really starts the workup to figure out what kind of disease we're dealing with. It's important to note that the scans that we get should include the area of interest, like the leg in this case, but also other parts of the body to look for spread. And that should certainly include the lungs, most importantly in sarcoma, and sometimes also ought to include the abdomen and pelvis. The next piece is to get a piece of it, a biopsy, a sample of the tumor that we can look at under the microscope. And you can see in the upper image, the sort of pinkish purplish, that's actually what sarcoma looks like, or one type of sarcoma looks like under the microscope. And so you can see, looking at this, how you need somebody with expertise to be able to evaluate these cells, send the appropriate testing and staining so that we can make the right diagnosis, so that we can steer the patient towards the right treatment. Whenever possible, I recommend something called molecular sequencing. This can go by a lot of different names, genetic testing, NGS, but essentially this is testing the tumor to see what are the genes that were mutated or rearranged that caused it to go from a normal connective tissue cell or bone cell and turn it into sarcoma. And in many sarcomas, there are characteristic or diagnostic genetic changes that help us pin down the exact subtype. And so you can imagine if we don't send that testing, we can't get the right diagnosis because we haven't looked. And the biggest point I want to make here is that because of the rarity and the nuance in the care of these cases, I think it's really important to be seen at least once at a major referral center, whether that's an NCI designated comprehensive cancer center like ours, or another academic site, but somewhere with some expertise and experience dealing with these sarcomas so that you or your family can get the best treatment possible.